Good evening, good afternoon, and good morning. This is the 1600th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, we are celebrating the 1600th day in a beautiful way by giving a Thanksgiving ceremony to our NCH team, particularly Dr. Anit Kuranasa. So let us begin the session with a prayer from Mrs. Ginu Jacob from Bangalore. Mrs. Ginu Jacob, please raise your hand. Please raise. Yes. You have joined in a different name. Mrs. Ginu, yes, I can see you now. Please, I shall make you co-host now. Okay.
I'm going to sing a song, What a Friend We Have in Jesus. It's a privilege to carry everything to God in prayer. You don't know the peace that we forfeit and the needless pain that we bear. Let's carry everything to God in prayer. What a friend we have in Jesus. All our sins and griefs to bear. What a privilege to carry everything to God in prayer. Oh, what peace we often forfeit. Oh, what needless pain we bear. All because we do not carry everything to God in prayer. How we trials and temptation. Is there trouble anywhere? We should never be discouraged. Take it to the Lord in prayer. Can we find a friend so faithful, who will all our sorrow share? Jesus knows our every weakness. Take it to the Lord in prayer. Oh, if we can heavy laden, come and be the Lord of cares. Precious Savior, still our refuge. Take it to the Lord in prayer. Do thy friends despise, forsake thee? Take it to the Lord in prayer. In His arms He'll take and shield thee. God will find us always there. Thank you. Over to you.
Thank you, Mrs. Ginu Jacob, for giving such a beautiful prayer song to this celebration. Thank you once again on behalf of IFPH. Please continue. And it is the time for a welcome speech. I invited Dr. Jose Isaac, the patron of IFPH, to say welcome all to the session. And it is up to Dr. Jose Isaac, sir, to begin the session.
Can you hear me?
Yes, sir. Your co-host.
Thank you, Dr. Thanesh. As all of you know, we are celebrating the 1600th day of uninterrupted webinar being conducted by the International Forum for Promotion of Homeopathy for the last 5 years. And during this period, in this 1,600 webinars we conduct, days of webinar we conducted, the whole galaxy of homeopaths have already been in our platform. That's a great achievement, which no other platform can boast of. Also, we could manage and discuss many various factors regarding the future of homeopathy, the present state of homeopathy, and also subjects which are not really related with homeopathy. Of any subjects of any public interest also was discussed in our platform. Already we could bring in doctors from around 60 countries around the globe, and now we have reached a particular level where we are having the 1,600th day celebration. My job is to invite all the participants here, and also our first to invite is our president, Dr. Ismail Said sir, who is the backbone of this IFPH, mainly because Dr. Anil Khurana, or the president of the NCH, who are supposed to inaugurate this function, could not reach here because of some acute emergency for his brother. And we hope that his brother will recover very fast, and our prayers are with him. Also, I wanted to welcome Dr. Mridul Kumar Sahani, the veteran of in homeopathy, a leading practitioner, my own good friend, mentor, and a member of CCH for a long time, and who was instrumental in many things done to homeopathy in the last 5 years. So not only 5 years, last 50 years, I would say. So I welcome Dr. Mridul Kumar Sahani to this forum. Also now I have to welcome Dr. Shashimohan Sharma, who is also a part of our family and has been helping us for a long time continuously. And I invite him to this forum to facilitate this program. The next to be welcomed is our own Vice President, Dr. Shaji Kudiyat, who is whose mastermind or the idea is the webinar idea is his idea, which has been going on uninterrupted for the last 2,600 days. And I invite him also to this forum today. Also, I would like to invite the participants from India and abroad who have been regularly attending our webinars and also contributing in some way, like a speaker or a observer or something, and has been helping us for a long time. All the Indian participants and participants from overseas, I welcome. Also, I hope that this program will be a success and it will go on for another 1,600 or 700,000 time or days uninterruptedly. I welcome our President, Dr. Ismail Said sir, to inaugurate the function.
Sir, you didn't mention about Javed Akhtar sir has joined.
Yeah, Dr. Javed Akhtar sir, okay, sorry to... Sir, we are you are also our family member. Javed Akhtar sir is from the beginning. He is one of the very active members from our neighbor country, Pakistan, and who has been giving us very knowledgeable and very valuable suggestions and speeches in this forum. Thank you.
Thank
now
you.
I invite our president to inaugurate.
Thank you. Thank you, Dr. Joe Isaac sir, for such a beautiful welcome speech. And since our guest president has not joined due to some problem, let us wait for that. Before that, it is the time to begin the speech. I invite Dr. Mridul Sahani sir to begin the session.
Thank you, Dr. Ganesh. Since I see that Dr. Anand Chaturvedi, who is also the member of the MARB board of the NCH, is present here. So, may I ask you to, on behalf of the Dr. Anil Khurana, he can speak something on this occasion. Dr. Anand Chaturvedi, you are present here. I had made you the co-host.
Yes. Yes, please.
He has left.
Yes, sir. Please, sir. Sir, you may speak now. Then we can have the inaugural session also, sir. You may speak for the time being, sir. Then we can go with our guests one by one, and in between we can do as and when they join. After you speak, you can call.
Okay, sir.
Yes, sir.
Thank you, Dr. Dhanesh and Dr. George Sisak, sir, for making such a beautiful introductions and welcome speech. So, in absence, Dr. of Anil Khurana, sir, our esteemed colleague, distinguished guest, and dear friends, today we gather here with immense gratitude and joy to celebrate a significant milestone in the field of homeopathy. The special Thanksgiving Day on 1600 day of the IFPH Forum is a moment to honor not just the vision, but also the unwavering efforts of everyone who has championed the cause of advancing medical education in homeopathy. On behalf of the homeopathic community, I extend my deepest gratitude to Dr. Anil Khurana, sir, and the NCH Educational Board for recognizing the importance of this step for the championship, the evolution of homeopathy into a more robust and specialized system of the medicine. At the heart of today's celebration is the acknowledgement of the memorandum request submitted on 23rd February 2024 in Kottayam by the visionary leader, Dr. Ismail Sheikh, President of the IFPH Forum. Dr. Sheikh dedications and foresight in advocating for the introductions of newer postgraduate super specialties course in homeopathy have borne fruits as the National Commission for Homeopathy, that is NCH, has recently announced its historic decision to launch a PG super specialization course in 6 critical branches: clinical oncology, clinical rheumatology, pulmonology, pediatrics, psychiatry, neurology, and endocrinology. This is a landmark decision. It's not just a victory for homeopathy, but also a testament to the power of collective advocacy, strategic collaborations, and visionary leadership. It reflects a shared commitment to expand the horizon of homeopathy and addressing the growing complexity to healthcare with advanced and specialized knowledge. To Dr. Ismail Sheikh, your leadership has an relentless pursuit of excellence have inspired us all. Your efforts in spreading this memorandum reflects your dedications to shape a brighter future for the homeopathy. Today, as we celebrate this achievement, let us reaffirm our commitment to work together to ensure these courses are not only implemented successfully, but also meet the highest standard of excellence. Let us strive to inspire the next generation of homeopathic professionals to embrace these specializations and serve humanity with compassion, skills, and dedication. Once again, I thank you all for your support, belief, and tireless efforts in bringing this vision to life. Let this Thanksgiving Day serve as a reminder for what we can achieve when we unite for the common cause. So thank you very much, and let us continue to work together for the progression of homeopathy and healthcare at large. So thank you very much.
Thank you, Sahani sir, for such a beautiful speak on our inaugural as well as the 1600 day celebration, sir. Now I invite Dr. Javed Akhtar to speak. Please unmute, sir. You are muted. Sir, please.
Good evening, distinguished guests, respected colleagues, and dear friends, IFPH team. It is with great pleasure and immense pride that I address you all on this historic occasion on the celebration of 1600 day of uninterrupted daily Zoom meeting. This incredible milestone is a testament to the commitment, perseverance, and shared vision of our vibrant and ever-growing community. We are delighted to have you as one of our esteemed guests at this special Thanksgiving celebration. Your presence adds meaning to this significant day as we gather to reflect on our achievement and express gratitude for the progress we have collectively made in advancing the field of homeopathy. Today's celebration holds a dual purpose: to honor the unwearying dedication that has sustained our daily meeting for 1600 consecutive days. Number one. Number two, to celebrate the monumental success of collective effort that has paved the way of groundbreaking advancement in homeopathic education. It was the 23rd February 2024 in Kutam that Dr. Asmal Seth, President IFPH, submitted a memorandum to request to Dr. Anil Khurana, advocating for the introduction of new PG super specialty courses in homeopathy. This visionary initiative addressed the growing need for specialized training in critical areas of modern healthcare, enabling homeopathy to meet the challenges of an evolving medical landscape. Today, we are proudly celebrate that acceptance of this memorandum and the recent announcement by the National Commission for Homeopathy through the Educational Board to launch 6 PG courses, super specialization courses in the following branches. Number one, clinical oncology. What is the significance of clinical oncology? Homeopathy has a lot of approach of different, but the specialized approach, the case taking, has a distinctive way to reach such cases. Should we take different methodology and what kind of methodology and how to understand the cancer and what kind of medicine and use. So it is very important, clinical oncology. Number two, clinical rheumatology. Rheumatology is the most important area in the homeopathy. Normally, we are taking the cases up in the rheumatology, like in constitutional medicine and like that. It is not a, you can say, take the case of rheumatology easily. You need specialization. I have dealt with such cases when I have selected the medicine on the basis of constitutional basis, the patients become aggravate. So what kind of medicine can select on that basis? So here I used over there, I did at the onset I was failed to select the right similum in especially rheumatology cases, because I was used to the other cases like the oncology and generalized cases. To say so, at that time the remedy was similum, but the patient was becoming aggravated. So at that time I talked to the senior doctors So how we can select the medicine, especially rheumatology cases, arthritis cases. So they told that you cannot select the similar medicine constitutional basis. If you select over there, so you may fail over there. Patient may aggravate, and there's a problem. So at that time, even most of the time I failed. Then I have selected the medicine local symptoms. Then when I was removing the local symptoms, and gradually I go to the similum, constitutional medicine. If I select it at onset after the medicine that the constitution, it was failed. There are a lot of, even then, personally I'm going to tell you myself, most of the time I failed in the rheumatological cases, because still I know it that it is difficult for me to select the right similum. So I'm proud to this that you have selected this topic, this specialized course, clinical rheumatology. In analogy, pulmonology, pediatric psychiatry. I'm going to the specialty psychiatry. Pediatric psychiatry is also, but psychiatry. Here is one thing is very important. When you take the history of the psychiatry cases, first you have to distinguish between is it psychiatry cases or not. There are two types of these psychiatric cases, psychotic and neurological. Neurosis, psychotic and neurotic. First you have to diagnose it properly. Is it a psychotic or neurotic? I'm going to give us one example. Same 2-3 examples. A patient who visited to me, anal pain. Patient was severe pain of the anal. He visited to many physicians, even he took the number of physicians, but the pain was not removed. There is no pathology over there. I gone through all the investigation, but pain was there. At onset, I did not diagnose it. Is it a psychiatric case or a physical case? Because patient was complaining like there is no history of this patient. The patient age was 60-year age, female. So there is no any troubleshooting in their life. Everything was fine, nothing to worry. I took a lot of history, but there was nothing. I found any kind of the psychological problem. However, there was no pathology. Then I have selected the similar medicine, but patient was not responded. So I was severely disheartened. Why is not patient is recovered? At the end, I diagnosed it. It is the psychological issues. It is the neurosis case. It is a hysterical problem. So when I go to the hysterical issues, because when I go to the hysterical issues, the patient got the response after 2 months. It means first we should diagnose the patient, very important, number one, and the protocol of the case taking is a little bit different. If you take the direct local symptoms, you cannot reach over there, because the psychiatric point of view thinking something else. He will think some in other ways. So I'm proud that you have taken this subject. Even psychiatry and pediatric psychiatry, both are there. These are both important. Another example in neurology. Why it is important? I'm going to exemplify the case of a patient who was suffering from the pain after toothache, after extraction of teeth. Patient was, after extraction of 5 years, was suffering from the pain of the toothache. It was so severe pain. So definitely I took those symptoms which patient described me. I having a pain and it was tooth extraction, and I'm taking the painkiller. Even then they are not working over there. I was fighting with the patient for the 5 months. I didn't get any single response of the patient. Then I felt something else. Then I go to the, even case is the neurological problem, nerves problem. Then I went to the psychiatry side, neurosis side. You can't imagine, when I selected the remedies according to date, the patient was okay. So it means we need such type of the specialized course. And same like the endocrinology, there are a lot of problems because I'm going to give the examples. If you 60 year 80 year before you go to there was a research conducted at the USA in the New York. It was especially endocrinology cases was very less. Sorry, it was very highest rate ratio. And after they researched over there why it was the highest ratio. There was the McDonald's and like that. There's the fast foods over there. So they worked over there. They should stop. And now this comes to, at that time, the research was conducted over the Asian countries, especially in Pakistan and India. So here ratio was too much low. In New York, it was highest ratio, and here was too low. So because at that time the people were using the saag, local sabzi, and all those things they are using. Now we peoples are shifted to that fast food, and they are come to the back of the saag and that's the natural foods. So here ratio is going to highest, and that was so here endocrinology is very important. We should know the research, we should know the themes, we should know all these things. Very important. What is the causes between, what is the external factor, internal factor. So in this way, it is very important. And how we can deal such cases, especially hormonal imbalance, it will also cause the endocrinology cases like the hormonal infertility, like that the male azoospermia, oligospermia, like that cases are coming over there, and skin care patches over there. So here very important, we should know it. What is why hormones are changes are different, because as Hahnemann said that you must remove the exciting cause. If we not remove the exciting cause, or we are treating the patient, you cannot reach the right result of the patients. So therefore, we must know about such diseases and the depth of disease and case taking and diagnosis. This achievement represents the transformative moment of the homeopathy. This super specialization courses will not only enhance the depth of the stature of homeopathy within the global healthcare community. Reaching this milestone has been a collaborative endeavor made possible the tireless effort of dedicated professionals, visionaries, and educators and who believe in the potential of homeopathy to address complex health challenges. In 1600 uninterrupted days of our daily Zoom meeting symbolize more than just consistency. They reflect a collective determination to learn, grow, and support each other. These sessions have been platform for sharing knowledge, fostering innovation, and building bridges between tradition and modernity in homeopathy. As we celebrate this special day, let us also look ahead with the renewed enthusiasm. The acceptance of our memorandum and the launch of these new courses are just the beginning. Together, we continue to push boundaries, innovate, and inspire future generation of homeopathy practitioners. On behalf of everyone involved, I extend my heartfelt gratitude to each of you for your contribution to this journey. Your dedication, passion, and unwavering belief in the power of homeopathy have brought us to a remarkable milestone. Let us cherish the achievement, celebrate our progress, and commit ourselves and continued advancement of homeopathy. Here, I would like to highlight the importance of super specialized courses and why they are essential for accurately approaching the simulum remedy for each sick individual. Diseases, disorders present in a variety of forms, and such hereditary, acquired, chronic, acute, mental, physical condition, each type require a unique approach to case taking and treatment. The nature of the disease also determines the specific need of the patient, whether it involves a complete cure, palliation, personality-based treatment, localized care, or superficial therapy. Additionally, there are various methodologies in homeopathy, such as a Segel protocol, classical protocol, sensation method, and other specialized modules like the Vavrick family finder, Boning-Hassan polar system analysis, Degrity, energetic remedy picture module. Each of these approaches offers distinct perspective and techniques tailored to address the complexity of individual cases. The introduction of super specialized courses ensure the practitioners are equipped with advanced knowledge and skills to navigate these complexity, refine the methodologies, and achieve optimal outcome for patient. Congratulations
Okay.
to all, and thank you for being a part of this incredible journey. Here's to many more milestones together. Thank you, sir. Thank you, sir.
Thank you very much, Davedakta sir. It's really an excellent presentation from your part on our super specialty courses in India. And we definitely hope you people also introduce such courses in Pakistan and in around the world also. We hope homeopathy will be the winner in those cases if we implement such thing. Thank you very much, sir. Please continue. Now I invite Dr. Shashimohan Sharma sir for 5 minutes speak, sir. Please unmute, sir. Our Said sir will be joining soon, so we will have an inaugural session soon.
Hello, good evening from United Kingdom. Can you hear me?
Yes, sir. Yes, sir.
But my video is not coming up. I don't know how.
Sir, your video is available, sir. You just raise your camera a little more so that we can see you in a better.
Thank you very much. Good afternoon from United Kingdom. I'm very happy today we are organizing this event on 1,600 days of our program going on very strong. And I'm very happy. I enjoy all the speakers. And I'm very happy that I am sharing my views and ideas with you. I listened to the previous doctor. He was very efficient and explaining homeopathy properly. So my best wishes to you all, especially Dr. Saji Kujia, Dr. Dhanesh, and other doctors. I know there are so many doctors here joining this event. My only advice for all my homeopathic friends to only rely on only one thing: totality of symptoms, a proper case taking, and then repertorizing and finalizing the best remedy. Dr. Manoj, I see you as well. Hello. So we have to depend on totality of symptoms only. There's nothing else we can take into consideration. We sometimes we see diagnosis, but diagnosis is only helpful, but it's not very helpful in selection of remedy. I have got so many cases to discuss. And maybe next time, because today is a special day and we are celebrating the special event. Dr. Dinesh is smiling. So definitely I will go through for the longer period next time. While I'm talking to you, I've got one madam sitting next to me. I'm preparing the medicine for her. So she will wait few minutes until I finish with you. So I again and again said, don't think of anything except totality of symptom that we will get after the proper case taking and in the peaceful time. And we should not hesitate to ask some symptoms which are there, but they don't explain, don't tell us. A few minutes back, I had a patient, she had the pain in the abdomen. I mean, the epigastrium, there are the 9 parts of the abdomen. So epigastrium, there was a pain, and I was giving her so many medicines, and she was in depression after the death of her daughter, and she was not coming out of the room even, and not going anywhere, only not even taking shower. She was all the time in the room, and she's a Muslim lady from Pakistan, and her brother just came few minutes back and took another medicine from me. So what happened then? Sometimes they don't explain you, don't tell you. They say pain in the abdomen, pain in the abdomen. But you must go through and ask again and again which part of the abdomen and what times it happens. So very surprisingly, 3 days back, she came to me early morning and she was crying. I said, don't cry, you're like my sister. I gave her some confidence. And then she told me that I have a pain in the upper part of the abdomen. That was the epigastrium. So I gave her colosynthes because she was feeling better by pressure of the abdomen and heat. Surprisingly, I found one medicine, very, very popular medicine, polycrus medicine, Nux vomica. And that was in the morning. She said, give me something now. I said, no, you have to take this in the evening. So I made her 2 doses of Nux vomica, 200. And next day I said, I give you more medicine. She said, only 2. I said, no, you take these 2, then I will see how this happens and what is the next, procedure. Surprisingly, overnight, Nux vomica 200 made her better. And she was very happy. She called me early morning. He said, I'm very happy. I want more medicine. I said, don't worry. I will go to office. That is very early in the morning. So this way, when we don't get a proper symptoms and proper condition, we can't find a select a proper remedy. Here, Nux vomica is one of the very common remedy, but it helped her and she is very happy. And then she want more. I said, so what should I give? Only polycrest remedy. We should not repeat too much. So I gave her Seclec pills. Otherwise, she said, give me more medicine, give me more medicine. She will take something else. So this way, homeopathy is definitely the best science given to us by our master, Dr. Samuel Hahnemann. So I hope everything is going fine and there are a lot of speakers here. And you continue this program. I will take part next time when I'm
Yes, sir.
a bit free because the madam is waiting here. And I'm very happy to join and see you all. I'm organizing one event in Lucknow on 29th of March. And the program is only for selection of remedy. And this program is called Mission Similimum. Mission Similimum, where I will do the live cases in the audience and then we'll select the remedy. And so many doctors from all over India are joining me there on 29th March at Lucknow. That's my best place where I was educated from National Medical College. So if anybody want to join and they can take the number from Dr. Dinesh or Dr. Manojji, and you are most welcome. I think that's enough for today.
Thank you very much, Shashi Mohan Sharma sir, for such a speech from the United Kingdom, and hope everything will be successful in the UK. Also, hope there will be some postgraduate courses in the coming years. Thank you very much, sir.
Thank
Please
you very much,
continue.
and I bye from United Kingdom. I still continue the program. I will listen to all other speakers now.
Okay, sir. It is
Thank
the
you,
time.
thank you, Dr. Shaji.
Please continue, sir. Please
Dr.
continue.
Shaji, long time no see personally. I will see you sometime.
Okay,
Dr.
sir. Thank you
Dinesh,
very
Dr.
much.
Manoj, and all of you. Thank you very much. Thank you. Thank you. Thank you. Namaskar.
It is the time for the inauguration as well as honoring the NCA's team for giving such super specialties courses in India. Yes, sir. So we proudly welcome our president, Dr. Ismail Said sir, to inaugurate the session. Welcome, sir.
Thank you very much. I'm very happy to get the opportunity. I heard about something about this one, but I am not fully be engaged because of I have some guests in my home. And that's why. Anyway, I'm very happily I'm inaugurating this section. Very proudly I'm inaugurating this one. Thank you very much.
Sir, for the short inaugural session. It's
Yeah.
now it's the time to Dr. Shaji Kudia to speak. Our Vice President, Dr. Shaji Kudia. Please unmute, Dr.
Thank you, Dr. Dinesh, and all the listeners from different corners of the world as IFPH is growing to bring the spirit of homeopathy across the world. Today, we have two important functions to mention here. One is the uninterrupted daily Zoom meetings in 3 languages, internationally, nationally in India, and locally in Kerala, from where the originators of this forum came from. So we are celebrating the 1600th day of the uninterrupted Zoom meeting, which never happened in the history of any system of medicine. And this is a remarkable achievement of collective effort of a team of dedicated homeopathy doctors to bring the potentials and possibilities of this wonderful system of homeopathic medicine to be available in every nook and corner of the world. And now we can see homeopathy doctors joining collectively from different corners of the world, bringing and getting inspired and starting courses in universities and collecting their friends to join homeopathy, and more spread of homeopathy happens. That is one important thing. These 1,600 days of continuous uninterrupted Zoom meetings involved so many people who are deeply inspired and dedicated in this system of medicine, and their dedicated effort is the reason for this successful
Yes, especially made for
mission.
me by the company in Germany. See, this is the beginning.
Dr. Seshan Sharma, please mute your phone. So that is one important thing. Then the second thing is, as homeopathy is growing, India is taking a leadership in that globally. And India is the first country to start super specialty courses for homeopathy. We are in the government of India under its Educational Board of National Commission for Homeopathy declared the starting of clinical oncology, clinical rheumatology, pulmonology, pediatric psychiatry, clinical neurology, and clinical endocrinology in homeopathy. So this is a very important thing, and we as IFPH can be proud of that we brought the inspiration for NCA to begin these courses through our Honorable President, Dr. Ismail Said Sir, who personally hand over the memorandum to bring these matters to the attention of the chairman of National Commission for Homeopathy, Dr. Gurana Sir, who are supposed to be our chief guest today, but unfortunately, due to some acute emergency of his brother, he is unable to attend us today. But we celebrate this today as a Thanksgiving Day to the National Commission for Homeopathy for accepting our Honorable President's request to start these courses for the deeper strengthening of the educational system and spread of homeopathy in India and across the world, so that people, doctors from students from across the world can come and learn in India, and also Indian doctors can become inspiration to spread it across the world. So because of these two important events, we are celebrating 1,600 day and Thanksgiving Day for starting this important super specialty courses for the first time in the history of homeopathy in the entire world. So with this, we are proud homeopaths, and we are proud to be part of International Forum for Promoting Homeopathy. We have achieved a lot. We have a long way to go. Collectively, with united effort, we will go further. And I request all to keep the spirit of unity and passion for homeopathy to bring this wonderful system to every nook and corner for the welfare of humanity. Thank you all.
Thank you, Vice President Shaji Kuriyat, for such a short brief on the importance of Thanksgiving ceremony in this celebration. Thank you all. And now I invite Dr. Prakash Kanikal from Kathmandu to say a few words, sir. Sir, your co-host, please speak. Dr. Prakash.
Dr. Prakash, you unmute yourself. You can start. Dr. Prakash Punikal, I think you adjust your mic. You are able to listen, Prakash?
So I'm not able to.
You can start, Prakash.
Yes. Yes, Dr. Prakash.
I think he's unable to, his mic is on, but
Yes, sir.
I
Yes,
think
sir.
you have to use the earphone, Prakash. I think you may be listening to me.
No, sir. He's unable to open, so
Yeah.
we can go to another guest and wait for him, sir.
Yeah,
Yes.
yeah. He's able to talk now.
Yes.
Dr. Prakash, yeah, please. Yeah.
Thank you so much for this opportunity. I am very much pleased to be part of this IFPH 1600th day celebration and Dr. B. Sahani's 100th birthday celebration. I am thankful to IFPH as well as Dr. Yamke Sahani sir for giving me this opportunity. And in the future also, I hope I will get the opportunity. Thank you.
Thank you. Thank you, Dr. Prakash Shenikal. And it is the time for Dr. Marian Salcedo from Bolivia to speak.
Thank you, Dr. Danesh, for this invitation. It's always an honor for me to share with you all, dear colleagues, friends, and homeopathy lovers. We have now 2 great events to celebrate. We are following all your steps in South America, and we are doing our best to follow you. Not always is easy, but we are doing our best. Today we gather to celebrate an achievement that marks an unforgettable milestone in our collective history. 1,600 days of the IFPH. This is a moment to reflect on how far we have come and to renew our passion for the purpose that unites us. 1,600 days ago, this forum began with a clear vision to be a space where homeopathy, founded on the revolutionary principles of Samuel Hahnemann, could flourish through the exchange of ideas, experiences, and knowledge. Since then, we have created something much greater than a simple discussion platform. We have built a vibrant, united, and committed community that transcends borders, language, and cultures. Through this forum, we have had the privilege of listening to exceptional speakers from around the world, doctors, veterinarians, agronomists, and researchers who have shared their insights and achievements, enriching our understanding and strengthening our practice. Each lecture, each debate, and each contribution has brought us closer to a stronger, more respected homeopathy that aligns with the holistic well-being of those who place their trust in us. We have also achieved something deeper, a return to the spirit of Dr. Samuel Hahnemann. This forum has been a constant reminder of his legacy, his relentless pursuit of a medicine that respects life, balance, and natural laws. Here we have revisited his texts with fresh eyes, delving into the philosophical and scientific foundations of his vision and finding inspiration to carry his legacy into the future. But we have not only learned from prominent voices, we have learned from each other. This space has shown that every professional has something valuable to offer, that our everyday experiences are just as important as scientific advances, and that together we can achieve far more than we could alone. I also want to emphasize the diversity of richness of our discussions. This forum has brought together professionals from vastly different contexts, united by a common purpose to perfect our art and heal with respect for the nature and humanity. We have shared clinical cases, discussed recent research, and explored innovations in fields like nanoparticles and nanomedicines, all while maintaining a profound respect of the principles of homeopathy. Without a doubt, 1,600 days is not just a number. It's a reflection of our continued commitment and our passion for learning, teaching, and building a brighter future for homeopathy. As we move forward, we must not lose sight of our purpose to work with our own scientific rigor as Hahnemann did, to open the doors to interdisciplinary dialogue, and to always uphold empathy and ethics as the pillars of our practice. This forum has not only been a space to expand knowledge, but also to reinforce our fundamental values. Well, I invite all of us to celebrate this achievement with pride, but also with humility. Let us continue to be guardians of Hahnemann's spirit and architects of homeopathy's future. Let us renew our commitment to keeping this flame alive, to sharing our experiences, and to inspiring one another so that every day becomes an opportunity to progress. I deeply thank each of you for your presence, your participation, your dedication. IFPH is a reflection of those who shape it, and thanks to all of you, we have proven that together we can reach unimaginable heights. Of course, it's not less to remind you to join all the Zoom sessions and visit our YouTube channel. Share it so we can spread more our science and activities. And a special thanks to the founders and the organizer team for this amazing job. We always have a very deep gratitude in South America for your hard work. So congratulations on this 1,600th, and may this be only the beginning of an even richer and more transcendent story. With all my gratitude on and admiration from South America. Thank you very much.
Yes, thank you, Dr. Maria Salceda. Yes, as you rightly point out, it is not simply a celebration, it is a family get-together also. Thank you once again. Hope all of you will be. And now I invite homeopathic lover, Dr. Sri Farid Bawa sir, to say a few words on this auspicious time, sir. Please unmute.
Hello, good evening. I think this is a very important moment, and I feel privileged to have this opportunity to address our August audience. 1,600 today. That's not a small thing. It's the world record, not for this health system, but I think no other system and no other things in continuous program for 1,600 days. That's a world record, no doubt about that. Besides, the quality of the program is very much appreciated all over the world, and including India and Kerala also. I think we will continue this teamwork, and we have to appreciate the efforts behind this. I don't want to name the numbers. Everybody knows that. I congratulate all the participants and all the organizers of these programs. Thank you very much. Thank you.
Thank you, Farid Bawa, sir. And it is a 1 minute talk to Dr. Ram Presa, sir.
Thank you, Dr. Dhaneji and IFPH President and हमारे Vice President Dr. Sajid Udiyat ji and everyone. Namaskar and congratulations. IFPH without interval 1,600 day celebration. Very, very thanks, Dr. Marian. Thank you. Very, very thanks.
Now, thank you, Ram Presa, sir. Dr. Harihan, sir, if you are there, please speak. Harihan, sir.
Yes, he is there in the participant list.
Yes, please unmute, sir. Please unmute. No, as the time. As we have just 4 minutes remaining, if anybody wants just 1 minute talk to someone else, I invite Dr. Manas to say a few words.
Yes, definitely have a lot of things to, because homeopathy is developing, and we are developing to the field of agriculture, veterinary science, Then in the field of medical tourism, the sports medicine, also favorite topic for homeopathy. Then also we need more specialization, especially and also the good manufacturing practice, especially in pharmacy, and the medicinal distribution must be the administration of medicine must be standardized. Different doctors, different methods. It is not good, but that is also good manufacturing practice as well as good medical dispensing practice also is need of the hour. Anyway, on behalf of very, very nice presentation, all things, I once again appreciating everybody's attempt. Thank you.
Thank you, Dr.
Wow,
Raj. And
wow.
now I invite Dr. Hibbert to say a few words.
So, congratulations, all of you. Very happy moment. This is a God's plan that we are passing on these 1,600 days. But now we are growing again and again. We are growing. What I want to say that we are going to start the medical journal in March onwards. So all we are expecting from your articles and everything. With then we can do it more. So a written e-journal will be there from March onwards. So in the three languages. So all should continue support to the to us. Thank you all.
Thank you, Dr.
Nice.
Hibbert,
Wow, wow,
and
wow.
thank you, Dr. Hibbert. Dr. Hibbert is the man behind uploading the videos, and Dr. Deepamala, please make your speak. Please unmute. Please unmute. Okay. You are still muted. Please unmute. Please unmute, Doctor.
Thank you. Dr. Deepala had very wonderfully managed the Hindi session also.
Yes. Yes, Doctor.
I am very glad to be a part of this forum. So thank you very much. This forum is very helpful to all homeopaths, and we learn every day new things and we all homeopaths get together in this forum. So thank you very much.
Wow, wow, wow.
Thank you, Dr. Deepamala. Deepamala is the person who is managing the Hindi session along with Sahani sir, and a beautiful way. Thank you for that. Please continue. And it is a time to say vote of thanks. I invite Dr. Sunil Raj to say vote of thanks because our secretary is not available now.
Good evening to you all. So today we are here to celebrate the 1600, the day of our 100th service of these classes and discussions. So the celebrations has inaugurated by our president, Dr. Ismail said. On behalf of IFPH, I am extending our sincere gratitude and thanks to Dr. Ismail said for the inauguration. And I am extending my sincere thanks to Dr. Anil Khurana for his immediate step to design and start the super specialty courses, which are the demand we are requesting for a long time. Anyway, came into reality. And I'm extending my thanks on behalf of IFPH. I'm extending my thanks to Dr. Sahani sir for his presence and excellent introductory speech. Dr. Javed Akbar did a very good speech about new specialty courses. Thank you, sir, for your presence and excellent speech. And Dr. Shashi Mohan Sharma for his excellent address. Thank you, sir. And Dr. Shaji Kudiyat, Dr. Jose Isaac, Dr. Prakash Panikar, Dr. Marian Sedeshu, Dr. Ram Shah, Dr. Hariharan, Dr. Hubert, Dr. Deepmala, Dr. Dhanesh, Dr. Manoj for their excellent work in continuing this excellent platform for this 1600 day without interruption. And thank you all the participants present here. Thank you on behalf of IFPH. We have to go a long way. Anyway, thank you all members present here to join hands with us for the uplifting of homeopathy in future also. Thank you. Thank you all.
Thank you, Dr. Sunil Raj, and those who attended, our president and vice president, Dr. Javed Akhtar, and Dr. Shashi Mohan Sharma, Dr. Jose Isaac, and all the viewers as well as participants in the session. Once again, hope that you will continue the endeavor of making this forum the most beautiful forum in the world. And definitely, we will achieve the first place in the treatment side also. That is, we are second to present in the treatment side. So hope we can all work together to take homeopathy the first. Thank you all. See you all tomorrow at the same time. Tomorrow we will have a presentation from Dr. Riji Rashid at 8:30 p.m. in international session. It is over to Dr. Manoj to moderate the Malayalam session celebration.